On November 1st, we held a global brain health strategy meeting in Washington, D.C., together with our consortium members. We are here because the increasing global impact of dementia and other neurodegenerative diseases, alongside the rapidly aging population, creates one of the largest health and socioeconomic crises we have ever faced. We regard this global brain health and longevity initiative as our moonshot, in which we believe we have a unique moment in time where the world is focused on brain health. We need to do this together, as these solutions will impact our world, our organizations, our workforce, and each of our families. Our vision is rooted in the value of the power of collaboration, innovation, and engaging a younger generation to bring a tangible impact that affects every government, every business, every family, every person. Additionally, we can work together to create change by harnessing the boundless reach across the private, public, and government sectors. So we asked, what if? What if there were a world without dementia? What if no family, no spouse, no child had to face the long goodbye? What if people knew what to do to preserve their brain health, since 80% of our health outcomes we control? What if we had earlier detection and prevention? And what if we engage a younger generation in the solution? That is exactly what we're doing.
And your advocacy is so helpful on that front, because they do listen, and us hearing from you, and you all going and talking to your own members. As you know, this has always been very bipartisan, the work on NIH and the work on this disease in particular, because no one cares if someone's a Democrat or Republican in terms of this disease. It can strike anyone.
There is no reason that our science, that our nonprofits, that our for-profits, that all of us can't come together around this.
We are a nation that is heading towards an unsustainable economic future and an untold one of horrors when it comes to the brain diseases we are seeing now developing at an alarming rate.
One of the things I've learned a lot about over the last few years is some of the challenges and some of the blessings of our older Americans, and how much they have to offer and how many challenges they have to overcome to actually thrive and to live their lives in the way that they want to live.
I remember turning to my wife and wondering, something's up. Well, soon after then, he was diagnosed with aphasia. I had heard of dementia, I had heard of Alzheimer's, I had never heard of aphasia. What can we do to help him? Well, there's something called Emotion AI now. Amazing. This new technology can pick up on cues of emotion.
Really, our brain is the most complex entity in the known universe. With 100 billion neurons, 100 trillion synapses, it's constantly changing. So we need everyone working together to figure this out.
We have 700 papers that look at the economics of Alzheimer's, of depression, of mindfulness, different dimensions of brain health.
It's all about system change, actually. And I wear quite a few hats and work at the cross-section of science, technology, policy, and investment, really to bring longevity innovation and impact to extend health span equitably and sustainably at scale, and really to maximize the longevity dividend.
We touch every day about 100 million consumers. One of the key pillars really of our proposition is nutrition.
So what is the MIND diet? I don't know how many of you are aware of it, but it is the Mediterranean DASH Intervention for Neurodegenerative Delay. And it was created by Rush University Medical Center researchers and Harvard University researchers. And they created it based on components of the Mediterranean diet and components of the MIND diet that were found to improve cognition. So in 2015, the initial study was released, and they found that those that followed this diet most closely had a 53% lower risk of developing dementia or Alzheimer's.
It's important that there are business models and ROI that work, that can help us scale to the next level of the intervention, number one. And second, because it's a fantastic opportunity to identify great young talent.
Dementia. In honor of my father, my brother, my mom, and I will not stop fighting for solutions and improvements to brain health, healthy aging, and dementia until no one has to experience the pain that my father went through. It's also important when talking about finding solutions and preventative measures for dementia and neurodegenerative diseases that we use inclusive language, because Alzheimer's is just one of many different kinds of dementia. For example, my father had Lewy body dementia, not Alzheimer's. This past summer, I was lucky to serve as captain for the Dartmouth College team in the Innovation Olympics. I want to give a huge shout out to my amazing teammates, which includes my brother Wesley Bevins, Leela Ambrose, Vedant Tapievala, and 3 people in the audience today. Please stand up: Gabby Novak, Megan Lynch, and Julia Papanasto. Our team decided to focus on food as medicine for our topic in the consulting and innovation competition. Because eating brain-healthy food is just one of many preventive measures people can take to lower their risk of having a neurodegenerative disease.
By looking at novel treatments for neurodegenerative diseases, looking specifically at probiotics, so personalized probiotics that can complement some nutritional interventions, as well as psychedelics.
We offer a one-time genetic profiling and quarterly microbiome profiling. This data allows us to create a personalized regimen of probiotic pills and probiotic-enhanced food and beverage.
Psychedelic-assisted therapy can provide is the neuroplasticity that Morgan mentioned. And that's beneficial in a number of ways. As we saw from earlier discussions, if you have faced PTSD, if you're facing treatment-resistant depression, if you're facing other forms of mental challenges such as anxiety, this can all affect your brain cognition and how you might progress over time and can become morbid with early onset dementia, Alzheimer's, and other factors.
But I see a world in the next 5 to 10 years where basically brain health is going to be how we look at this disease, but we've got to drive it into every nook and cranny of the country.
I say we're the social workers behind the diagnosis, and we provide innovative programs for people with the disease. An average caregiver provides 18 hours of care per week.
How exhausting our particular situation is as a caregiver 24/7 for my husband, who was diagnosed with Lewy body dementia about 1.5 years ago. And the progressiveness of the nature of the disease has just devastated us on every level imaginable.
On the healthcare side, the time is now. We have to make something happen for the people all around the world and in this country who are really facing these challenges.
All this healthcare and caregiver workforce shortage crisis that we're facing in this country. We can solve some of our challenges with brain health through innovation and those amazing future leaders from the student teams, through bottom-up movements from consumers, citizens, people demanding change.
When we talk to our residents, they tell us what an improved outlook they've had. And it's because of the nutrition they're getting, the socialization they're getting, and the engagement that they're getting on a regular basis. 70% have an improved health outlook when they move into our building.
Food as medicine is a revolution that has to come to Washington. Brain health is a revolution that has to come to Washington. We're a nation right now headed in the wrong direction. I am confident when I get invited to incredible groups like this that the makings of a movement are here and upon us. And I really hope we all are successful.
Just imagine the power that is in this room and the power even not in this room, because our consortia has over 120 members right now. 3 million employees and over 1 billion people served. We have an existential crisis that is crippling our governments, it's crippling our economies, it's crippling our families. The cost is immeasurable. And if we can't get around this one, I don't know what we should be doing. As my brilliant daughter and my son, who helped create this business plan, Wesley, who's been on the whole time, the absolute spirits of my life, with every fiber of our being, this is what we're doing until it's solved. But I really do fundamentally believe the science, the workforce, the collective will, we can solve this. This is not our destiny. If not us, who? And if not now, when? Profound words from JFK that are so applicable to today. We are profoundly grateful for the power of our consortium and all the organizations committed to getting things done together. We are data-driven, action-oriented, and fundamentally believe that the power of collaboration can solve complex issues. Thank you to everyone who has made such an impact so far, and we welcome anyone who wants to join us. The power in this room and of our consortium impacts millions of people, employees, constituents, consumers, and most importantly, each of our families. We are determined to work together to put an end to dementia and bring all that we know about brain health to the places we live, study, and work. Thank you so much for coming here today, and I look forward to the journey ahead together.